This is task 50, dental. So just wanted to go through some of the instruments we'll be using today and the things that we need to have on hand when we perform a dental. So I'm going to start with the calculus removal forceps. These forceps are used to remove large chunks of calculus from the teeth at the beginning of the dental. So this long edge goes against the crown of the tooth, while the short edge goes underneath the calculus. We would squeeze those together and they break off large chunks of calculus. Once the large chunks of calculus have been removed, we go ahead and scale the teeth. There's two ways we can do this, with a manual scaler, which I have here, or with an ultrasonic scaler, which I also have just down here attached to my dental machine. So scalers have three sharp sides and a sharp point at the tip, and they're used to remove calculus from the teeth supragingivaly, so from the tooth itself, not from under the gum line. We use these in a sweeping motion down from the crown to the apex of the tooth to remove the calculus. We would use the manual scaler in conjunction with the ultrasonic scaler. Then once the teeth themselves have been scaled, we would work subgingivally to remove the calculus, and we do this using a curette. So this is a manual curette, and it has a blunt tip as opposed to the sharp tip of the scaler, so we use this to get up underneath the gum line to remove the calculus there. We can also use the ultrasonic scaler tip to do this, as it's designed a little bit differently from the manual scaler. Once the teeth, all the calculus has been removed from the teeth, we'll go ahead and rinse the teeth. So I have my handheld rinser again attached to my dental machine. This one blows air and water to remove debris from the teeth, or from the mouth. Once we've removed the debris, we would polish the teeth. So I have my polishing attachment to my dental machine, and I have my Profi angle. So I'm just going to go ahead and open this up and attach it to our Profi device. So we just pop that on, so we're ready to go, and lock it into place. We use Profi paste with this Profi angle, which I have here is just an individual one. So there should be enough in here to do one dog. So we would use the Profi cup, fill it with paste, and go ahead and use it to polish up the teeth. So some of the other instruments we may need during a dental are to help with extractions. So we have elevators. We've got an example of some different sizes there, and these are used to raise the tooth from the tooth socket to aid in extraction. And then once those have been used and the tooth is raised, we can use our tooth removing or extraction forceps. These attach to the tooth and help to extract it. We also then finally just have our dental probe, very important piece of equipment. This is a banded probe, and we use it to check the depth of the pockets between the teeth and the gums. So I think that's all. So that's all the instruments that we should be using and needing today. So just wanted to go ahead and talk a little bit about safety, both for myself performing the dental and obviously for the dog. So while we're performing a dental, dog will be under general anaesthetic. So we have already placed a catheter. So we've got venous access throughout the procedure. We also have our anaesthetic machine correctly assembled, and we have a monitoring device to monitor all the parameters while the dog is under anaesthetic, and we'll also have somebody on hand monitoring the anaesthetic and the animal while I'm performing the dental. We have a heating pad set up here. Sorry, it's my anaesthetic machine. We have a heating pad set up here with a blanket on the top of it to keep the dog nice and warm, prevent any hypothermia. And I have some towels to help position the dog. It's important that when we're performing the dental that we minimise the amount of water and debris going down the throat to prevent aspiration. So we're going to use a cuffed ET tube to help prevent this, as well as some gauze pads pushed down into the back of the throat to prevent any excess water from getting down there. And then for personal safety, for me performing the dental, I do have a surgical cap. This is purely personal, just to keep any debris out of my hair and prevent my hair from falling over my eyes while I'm performing the dental. So it just keeps everything nice and clean and out of the way. Obviously, non-sterile gloves, and we use these to prevent the absorption of bacteria in the mouth into the skin, and also to prevent any toxicity that may be caused from any chemicals that we may be using today in the process of doing the dental. I have a surgical mask. Again, this is when we do the dental, obviously the dog's mouth has a lot of bacteria. We're using water, and this can help the bacteria aerosolize, so we want to make sure we don't inhale that and cause ourselves any infections or problems. And then finally, I have my safety glasses. Again, this is to prevent any bacteria from getting into my eyes, and also there is some risk of calculus that we chip off may come flying out, and we just want to protect our eyes from any damage. So I think that's everything set up and ready for the dental. So I'm going to go ahead and get the dog under anaesthetic, and we'll begin our dental.